Carpha stands for the Caribbean Public Health Agency. It is a unified public health agency comprising 5 previous regional institutions in epidemiology, environment, drug testing, health research, and food and nutrition. And the idea came about, many people had the idea. I was one of those who wrote about it in 2003 and 2004. And then I guess formally heads of government of the CARICOM region identified that this was an important part of strengthening the health and wealth of the Caribbean. And in 2011, they signed an intergovernmental agreement to give rise to the new agency. Well, as a public health agency, our job is to prevent disease and disability, to promote and protect health. Those are some of your core public health functions. To do that, we monitor diseases, we help and advise on policy, we run the labs for the region, we run a laboratory network that connects up all the countries. We do training and capacity building, we do research, we build alliances. Those are some of the tools of doing our public health work to prevent disease and promote health and protect health. Some of the problems that we are focusing on include still infectious diseases, including HIV and AIDS, the non-communicable diseases, childhood obesity is of particular concern, the problems associated with injuries and violence. So the purpose of all of that is to lengthen life, to make a better quality life, and to give the Caribbean better prospects for the future. We also are addressing many of the environmental challenges through Carpha that the region faces. So this combination of public health and environment measures will improve the health and development prospects of our region, and I think make a mark globally. Public health is population health. So an individual doctor may see you as a patient and say, and what's wrong with you today, and listen, and they make an examination and make a prescription, and then come back and see me in 2 weeks. Public health is similar, but at the level of a population. So you may ask the whole country of Barbados, or the people who live in the interior of Guyana, which is a whole population. What are the problems that they face? What are the causes of those problems? What can be done? And then we advise the government and work with the government to improve those health conditions, to prevent disease, to extend life. So public health is about preventing disease, promoting health, protecting health. Those are some of the words to put it in that may give it more meaning. Partnerships and networks will be fundamental in achieving Carpha's work. Why? Many of the health problems we face today cannot only be solved by the Ministry of Health. If you take problems like the non-communicable diseases and obesity, we need to work with employers to have healthy workplaces. We need to work with education and schools so that school feeding is better. The advertising of junk food to children is restricted. We need to work with ministries that the people who have a problem with weight are being seen and attended to properly in the health services. So that's one example. If you take an area of like tourism and health, where the Caribbean is so dependent on tourism, then we in public health can add value by ensuring that the back of house quality issues are attended to. Food safety, Legionnaire's disease prevention, workplace wellness. These things will help the economy of the region. In doing it, we have to partner a lot. Insurance companies and banks, it is in their interest to work with us because the improved health of their customers is good for their business. Carpha differs from PAHO. Well, we're similar in that we're both international public health agencies. The difference is that we are more operational. We're going to be working, and another important difference is that we're running the laboratory network for the Caribbean. So in terms of infectious disease monitoring and response and investigation, we will be right at the forefront. PAHO WHO is the overall normative meaning they will put out the guidelines and the norms that we should follow in public health in the world. We adapt those and we work at the implementation of them locally. So it's a complementary relationship. In some areas we would overlap and we would take care to avoid duplication and to have complementarity. The coming together as one is the first step. The second step is to move everyone here and here to somewhere new in collaboration and in discussion with ministries about how we deliver our mission. Some of the added value comes from the synergy between bringing together the 5 different agencies. So you're combining the research agency with the former CAREC, the Food and Nutrition Agency Institute, the environmental health. So you get the cross interdisciplinary work that really enriches and adds value to member states. So if somebody is working on water quality, for instance, they can work also with an epidemiologist that as the quality of the water improves, you can track that human illness is improving. The folks who are working in research, they can help guide the other scientists in the agency so that research is better quality and serves the members better. I think other areas in which we will add value includes helping the Caribbean with some of the what I call global health diplomacy. So the Caribbean countries have literally led the world in the NCD charge, the non-communicable diseases, heart disease, stroke, and so on. And we will work to help continue that leadership globally for the Caribbean. We really have done something, we in the Caribbean have done something amazing. And there's a need to continue that leadership and not rest on our laurels. So part of our job is to respond to emergency situations and to help coordinate the response to emergency public health crises. If it is something like a hurricane or a volcano, CDEMA would probably be in the lead and we would support. In other words, after a disaster, what kind of monitoring mechanisms do you need to put in place rapidly? What do you need to be alert to in environment and health conditions, dengue transmission, gastroenteritis, and so on, to make sure that the country is being supported? If the emergency is an infectious disease outbreak, probably we might more be in the lead. If it's a nationwide problem or a multiple island problem, then we might be more in the lead and CDEMA might be a bit more supportive. It depends on the scale of the problem. But were cholera transmission to come back into one of the islands spreading from Haiti, that would constitute a disaster that would require both a strong public health lead and an emergency response management need. I think we have made impact in a number of areas. If you take the area we were just talking about, emergency response, we've had 4 requests this year so far for assistance to outbreak situations. So there was a norovirus outbreak in the tourism community in one of the British islands that we assisted with. In the Eastern Caribbean, there was one of the countries that reported an upsurge in tuberculosis, and we sent somebody to look and support the country. One of our mainland territories has had a big outbreak of gastroenteritis, which has been confirmed as rotavirus by our laboratories. So I think those are some practical examples of where we have already for the year been helpful. On another project, we've done a lot to improve country capacity in managing biological risks, strengthening their labs, and so on. So those are some of the areas where already I think you can discern an impact. That's a very good question. It's about how do you convert the science and the theoretical knowledge into practice. By working very closely with and advising governments, by partnering with civil society so that they become champions and cultivating champions for the issue you're dealing with, by working out what is the economic impact and presenting the data on the costs and the return on investment from your intervention that you're going to make. I think in these ways we can help. We will work very closely, we already are, with the CARICOM Secretariat, and they are the conveners of the other policy groups, not only in health, but in trade and economic development, in foreign affairs, and so on. And so working through and with them to get public health issues onto the agenda, for instance, of the trade people, that will be important. We will work closely with the Pan American Health Organization that has the overall global responsibility. So I think in those ways it is possible to bring real change, to make real change happen. There are several. We have a wide variety of countries that range from, say, Guyana or Haiti, which is fairly sizable, to really very small states that have a challenge in capacity. So we're partly their capacity and backing them up. But that is a challenge, the smallness of many of the countries, the economic ups and downs in the world, and the tourism industry, which is the mainstay in many countries. That's another challenge. The travel-related problems. We're tracking what's happening with the new bird flu in China, but that could be here, you know, next tomorrow or next week. So we live in a very globalized world. That's another challenge. I mean, a fundamental challenge is, of course, securing the resources to do our work, both from governments and from partners. So far, I've been very encouraged by the goodwill and level of interest in member states and in partner agencies for us to succeed in that regard. I think although we come from a region of the world that is made up of small countries, we can dream big. That sort of dreaming aside, I hope in 3 or 4 years that Carpha would be a recognized player on the global public health field. We live in a globalized environment, and with the travel and tourism that this region has, with the movement of our own people in the Caribbean in and out of the region, we need to be much more globally plugged in and bring together in Carpha the best public health practices that exist in the world. Whether it's in Brazil, whether it's in Australia, whether it's in Vietnam, find it and bring it and create something really unique here that, as I said at the beginning, really helps to improve the health and the development prospects of Caribbean people. And I think we can do it. This is the best job you could do in public health at this time anywhere in the world, to set up a new public health agency. So I'm really happy. I'm the person who's going to do it.